Welcome to Be Well, an It's Okay webinar designed to promote and support mental, financial, physical, and social well-being. Be Well provides insights, tips, and strategies for enhancing all aspects of well-being through conversations with experts. Whether you want to manage stress, improve your financial health, boost your physical well-being, or enrich your social relationships, this webinar is a go-to resource.
Welcome to the first It's Okay, Be Well webinar of 2026. I am Kate Fisher, and today we are going to be talking about burnout. Burnout is something that, it's a term that we hear a lot. It's actually a clinical condition, but it's also used quite casually. And because of that, it's often misunderstood or minimized. In our session today, we're going to really try to better understand what burnout is, how we can recognize the signs and the symptoms, and why getting the right kind of support really matters. To do that today, we are grateful to be joined once again by Dr. Joe Grasso from Lyra Health. Lyra Health is our EAP partner in the United States, and they have been really great at helping us work through a lot of the webinars and sessions that we do. And Dr. Joe has been a guest in the past. He brings today a clinical perspective and some practical insight into what burnout looks like, how it can affect our mental health, and what meaningful support really looks like. If today's conversation resonates with you, we want you to know that you are not alone, and there are resources available, and we'll share those towards the end. And in the spirit of It's Okay and shared stories, I will tell you that for those of you who have joined our past sessions, you may have heard me talk about the fact that I have been a caregiver for the past 3 years at least. And last year in August, I was diagnosed with burnout, and it was very surprising to me because I talk about mental health all the time, but I never actually thought that it would impact me, and it did. And I did get support through Lyra, and I can tell you that 8 months later, I feel really good again. So if this is impacting you, I do hope that today's session can help you, and we can get you what you need to feel better. So with that, welcome, Dr. Joe. It's good to see you again. So thanks for being here.
Thank you.
I'm going to start with like the basic question, which I think a lot of people ask, what is burnout? How do you define it? And why is it so important to understand?
Well, first of all, thank you for having me, Kate, and for speaking to this topic, both from the professional side of things, but also personal. I think it makes
it's important. It's important, I think, for people to understand that nobody's alone. We all go through this type of thing, and there are ways out. I'll put it that way. That was the exciting part for me. There are ways out.
Right. And we need people to have a sense of hope that if they are experiencing what we're talking about today, there is a path forward and a lot of support to help. So, on the question of what is burnout, you teed it up really nicely. I think it's very common to say things like, "Oh, I'm burned out on takeout," or "I'm burned out on this TV show," or it's a term to kind of describe I'm over it. In reality, it's kind of underselling burnout because, like you teed up, it is a clinical condition in that the World Health Organization recognizes it as a clinical condition. And what's really important is that it's not just a clinical condition, it's an occupational health condition, which means when we talk about burnout as a formal diagnosis, it really refers to it being a work-related syndrome that is characterized by three things. One is emotional exhaustion, this sense of feeling chronically depleted. And sometimes it's not just emotional exhaustion, it could be cognitive or mental exhaustion. And it could be a sense of physical exhaustion too. But usually that emotional exhaustion is a core piece. The second feature that defines it is a sense of cynicism or depersonalization. This means I'm starting to check out. I'm starting to feel like this work doesn't matter. Maybe I'm on the sidelines and I'm the cynic who's predicting doom and gloom for everything that we do or try. My whole morale and attitude towards work has shifted toward skepticism or scrutiny. The third characteristic is maybe the most insidious. It's reduced professional efficacy, which means I don't feel capable or impactful anymore. And this is one that I think often gets overlooked because a lot of times when we look at people who are burned out from the outside, they can actually look like they are either very effective or very engaged. They're putting in a lot of effort, they're working really hard, but underneath the surface, they can be dealing with this sense of no matter what I do or how hard I work, I'm not impactful enough. I'm not doing enough. And eventually, all of that overwork leads them to become depleted and they end up kind of living out this self-fulfilling prophecy that they're not effective because eventually they just give up on trying. So I think it's important to kind of cap this here with the fact that burnout is not just about working too much. It's
Yeah.
really this misalignment between what the job is demanding of you and your ability to meet those demands and your willingness to engage with work because of how exhausted or worn down you feel.
And I one of the questions I have, and I want or the clarifying pieces is, we talk about this in terms of work, but
Hmm.
um, what can cause the burnout can be a multitude of things, but it
Hmm.
tends to show up at work or in some place where, we spend a, a significant part of our day at
Yeah.
work. So, you know, the idea, I think there is an idea that it is always work that leads us to burnout. And I think that can absolutely be true. I think I've been there in the past, but I think that, for me, it was this external thing that was happening and it made dealing with that and work just the load got to be too much. So, is it important that we are looking around, it, at all the facets of our life to understand where is this coming from? you know i
Yeah.
I think that that to me is important. But
Hmm.
one of the other things, we talk about burnout, but when we think about just everyday stress, or
Hmm.
you're working on a tough project,
Hmm.
how do you sort of make the delineation between what's normal, and I think you touched on it a little bit, but what is this is actually concerning. Like, this is when, is there a trigger for when you go, you know this is, I now need help.
Hmm. Yeah. You brought up a lot of good points. So the point around burnout can show up at work, but it's not always fully caused by work. That's true. So
Yeah.
I think it's helpful to think about burnout as this intersection between what's happening with you and what's happening in your environment. And
Yeah.
so if your personal life is especially stressful and you have things going on at home or in life outside of work that's just making it hard to show up with full capacity to do whatever is on your plate, and you feel like there's not a way to manage work in a way that fits what capacity you have, that can
Yeah.
create the recipe for burnout. And so then that means looking at what needs to support you in your life outside of work so that you're not showing up at work so depleted. But then it's also thinking about, are there things that I can do at work to support me and getting the work done even as I'm going through this stress? So it's really needing to look at it from all angles. So that was a
Yeah,
really
and
good
I
point.
and I think the ability to ask for help and be able, one of the things we talk about is the stigma that surrounds all mental health, but especially this thing. And I will say, in my experience, I'm Gen X, so
Yeah.
we were brought up in a certain way, pushed through, right? And it took a long time to ask for help. It took a long time to say at work, I can't do this anymore, because in my expectation of myself was that you just keep going. And so I
Mm.
think what I would say to anybody who thinks they're going through this is that, you have to forget the stigma and you have to just ask for help and talk to the people closest to you, at work to understand, can I get help? What are the resources? So just that's just a comment. But when we think about burnout, do you think there is a greater prevalence of burnout than there was, or that is it just that we're hearing more about it because the stigma's
Mm,
going away, right? We were hoping we reduce
yeah.
stigma, but I feel like, was burnout even a clinical term 20 years ago? I don't know.
Yeah, it was a term that was used to describe a set of symptoms, but it wasn't recognized as a clinical condition the way
Okay.
it is today. If we
Okay.
go back to the earliest days of talking about
Yeah.
burnout, and I think for a long time, that meant burnout was kind of marginalized. It's like, oh, sure, people are stressed at work. Kind of going back to your question from earlier, what's the difference between everyday stress and burnout? A lot of people were mixing the two together, and that makes it much easier to disregard burnout as a legitimate condition. So, fast forward to today, where more people than ever are reporting burnout, and also employee engagement has been, on the decline for several years, like at a country level. Um, what you're seeing is that there's more ability to acknowledge that you're burned out. So the stigma issue
Yeah.
is less, which is good, but there's still more work to do. But we also think that burnout is increasing in prevalence. It's not just more people saying that they're burned out because they were there all along and now they're just coming out of the shadows. We think there are also more people becoming burned out than there were before because expectations in the workplace have changed. Day-to-day life has gotten maybe a bit more stressful, more unpredictable things happening in the world that affect people outside of work and then affects how they show up at work. So there's just a lot of different factors. But something you touched on that was really important, I want to emphasize, we're all going to experience stress. And stress is different than burnout. And stress is actually healthy. If you think about, I always use the analogy, if I have a long to-do list and those things are important to do, they're important to me, they're important to someone else, and I'm laying on the couch with a bag of potato chips on my chest watching Netflix and it's saying, do you want to go to the next episode? I actually need some stress. I need it to motivate me to do the things I need to get done. So stress in in for the short term, in the right bursts, for the right amount, absolutely healthy. Stress is transient. Burnout lasts a long time. So when we think about the difference, we're thinking about stress being this acute motivator. We're thinking about burnout being something that is prolonged and depleting, not motivating. And so what research tells us is when we are emotionally exhausted, we can recover with rest. But if there's these other pieces like the cynicism, the feeling ineffective at work, no matter how hard you try, those are harder to reverse with just rest, the way we would recover from stress. And those are the things that can actually predict depression over time. So that's why burnout and stress are different and we have to treat them differently.
Well, and that's a really good. I actually have two questions, but the
Mhm.
one of the questions is, we had questions ready that were talking about the signs and symptoms, and you've touched on them a little bit. But how does, like, where is the intersection between burnout and depression? I feel like I came out of this, and I'm not perfect. Well, I think I'm perfect, but I'm not perfect. I'm not, it's not like suddenly everything is fixed, but I had this threshold where I went, okay, I've left this behind. I feel better. Some
Mhm.
people might not, because they could be dealing with, I would think, multiple things. Like that,
Yeah.
can burnout run alongside depression and anxiety, and sort of how do you separate these in getting the right treatment?
Yeah, it's a great question because in mental health, a lot of things become tangled with one another, and it can feel hard to understand the picture of everything that's going on. So First, I would say it's important to know your history. So if you know that you have a history of getting depressed, having anxiety that feels more severe and significant than everyday normal anxiety, certainly if you have a history of diagnosed mental health concerns, you want to be even more vigilant to burnout because that has a what we call a compounding effect. It makes it more likely that your burnout will increase your depression symptoms or increase your propensity to anxiety or other mental health issues. So that's one piece. It also works the other way. If you become burned out first and you don't treat that burnout, we know that burnout can predict depression symptoms. And the difference between the two is, burnout is really about I'm exhausted, I'm checking out, I don't feel like this matters anymore, and I don't feel like I can make a difference. So if you experience anything resembling those symptoms,
Yeah.
you need to be considering burnout. What then shifts if you're starting to experience depression or an anxiety disorder that's co-occurring with burnout, you're going to have symptoms that are coming along for the ride that are different, like a sense of helplessness or hopelessness, um, checking out from other activities outside of work, feeling like nothing brings you joy or happiness anymore, engaging in the things that used to bring you a sense of meaning now feel dull, and certainly interruptions with things like sleep or nutrition, diet, appetite. Now we're talking about something bigger. Kind of same thing with anxiety. You start to know you can't stop worrying. You're thinking worst case scenario all the time. You're starting to find that you're on edge, irritable. Now we might be talking about something bigger than just burnout. And so the good news in all of this, no matter if it's burnout alone, burnout with depression, burnout with anxiety, all of those conditions are very treatable. And meeting with the mental health provider is the first step towards getting the kind of help that can be tailored to whatever grouping of conditions you're dealing with.
That you have. Do you think that there are and I'm already seeing some comments about this in the Q&A, but what are the misconceptions about burnout that sort of keep people from getting help?
Yeah, I think it goes back to some of those stigmatized beliefs, like
Mhm.
everyone's tired.
Yeah.
I'm not special. I'm no different. This is normal. Or a sense of self-blame, which is very common for people dealing with burnout. Because one thing we didn't touch on, burnout is this intersection between what's happening with me and what's happening in my environment. On the what's happening with me side, we know that people who are high in what's called conscientiousness, it's a personality trait, they tend to be at greater risk for burnout. If you're very conscientious, you're very detail oriented. You care a lot about your work. You're very aware of the possibility that things could go wrong, and you're very quick to try to maybe perfect your work or over control your work in ways that are going to make it not sustainable over time.
Okay.
So, a lot of times, people like that who are very conscientious, their first instinct when they start to struggle is to blame themselves and say, oh, well, if I had just worked harder, if I had better work habits, if I was more effective at coping, this wouldn't be a problem. And so instead of going to get help, even help with those things they don't feel like they're the best at, they double down on just pushing through themselves and looking for ways to do it on their own because they feel like I should be able to figure it out on my own. And that gets in the way of getting help that's going to be a lot more effective and efficient from bringing someone else into the picture versus just trying to do it all yourself.
I can attest to all of this. So
Yeah.
yeah, that's spot on. But I want to talk, my next set of questions is really going to be about what does getting care look like. But I have two other sort of side questions. Do you think that, or do you see a difference, through treating people? Is is there a generational impact to this? Like, I feel like if you might be I feel like older generations, and I'm part of that older generation, it's harder. Like we were not brought up this way. And so I feel like people in my own family, were they get it. They're much more likely to say who are younger in my family were much more likely to say to me, yeah, this is what's wrong. You're burned out. Go get help. Whereas
Mhm.
that wasn't my experience. And so how do we sort of if you are someone who is buried under that weight of what you grew up with and and how you should be, how do you shed that? How do you just get rid of that and say, I don't care. I don't care if this is what I grew up believing. I have to go and do this thing over here.
Yeah.
How do you get
Yeah.
yeah, I keep talking over you. So
No, I love it.
yeah.
I love the points you're bringing in because I think you're speaking to people's lived experience.
Yeah.
Depending on who you talk to, you may get encouragement to reach out, or you may get a kind of a message of tough it out. Or
Yeah.
I know what I had to deal with in the peak of my career. It's a rite of passage to become burned out, or this is something that you need to learn to deal with because it's a inevitable part of work life. And I think you're right. There are generational differences. There are generational differences in attitudes about mental health in general. What
Yeah.
is something that is a diagnosable, credible condition versus what is a personality flaw or a lack of resilience. There's also differences around how people think about burnout itself. Is this a real clinical phenomenon? Is it just work stress? And so, what I would say is if you're talking with someone who you feel like has a generational perspective that is different than what you're experiencing, your experience is your best source of truth. So,
Yeah.
if you feel like, gosh, I have tried coping with this on my own, or I have tried pushing through thinking this would be a temporary situation, and now I'm feeling more worn down, that is data. And you need to be paying attention to the data that your mind and your body are telling you. Because if you ignore that, because you're comparing it to someone else's experience and saying, well, this shouldn't matter. I shouldn't be feeling this way, or it shouldn't matter that I feel this way. That's just going to get in the way of you being able to fix what is clearly wrong. And if you think about it like in a purely pragmatic sense, we all want to be effective at our jobs. We all want to go through life with less struggle. So the goal is to make it easy on ourselves. And instead of shaming ourselves for feeling something or saying, I shouldn't feel that because so and so says that's normal or they don't feel that way, take the shortcut
Yeah.
and get help from someone who can help you understand why you feel this way and what is going to be effective at getting you back to a state that makes you feel like you're yourself again.
Yeah, and that's why it was important to me. I debated how much I wanted to say on today's webinar about my own experience, but I feel like shared stories are the one of the best tools in our toolbox. And I went through all of those things you're saying. I'm going to ruin my career. Yes, people, of course, my boss is a wonderful human. Of course, he's going to understand. But is it going to impact my career?
Yeah.
Guess what? It didn't.
Mm.
Guess what? We all got through it. And I have more work than ever. Apparently, apparently that was okay. You know,
Yeah.
but that scariness, and I had to ask myself, was I more worried about what he was going to think, or was I more worried about what I was going to think, because I had set a plan in my head for what my career and my life was going to look like.
Yeah.
And so it was important to me to say this today, and I decided in the 30 minutes before that I was going to talk about this, because I would hate to think somebody is thinking, I don't want to get the help I need, or take the time I need, or raise my hand and say, hold up, I need some support. When Cummins, and I guess I'm saying this to our audience too,
Mm.
and I realize I can't speak for all 70,000 employees. Everybody's got a different experience in a different group. But overall, I have found in my years at Cummins that the culture is one that is caring, and more than most companies that I've worked for, I do believe there is a vested interest in helping people. So, which is why we do what we do here today. And so I'm hoping that, that helps, even if it helps one person. The other question, and I think it may have popped up in the Q&A too, is I keep thinking like, what does like the world we live in today is very different than a world 20 years ago. So,
Yeah.
and I had a friend of mine recently say to me, because of everything going on in the world, don't you think life is really hard? And I'm like, well, I think it's got ups and downs, but can, what's the impact of social media
Yeah.
and current events? And not that I want to speak to current events, but like all of that feels like a burden on a lot of people.
Yeah.
How, wh- what's that role in burnout? Can you actually feel burnout because like the world is too much right now and you're getting it from all sides because of social media?
Yeah. Yeah. So that's a good point going back to something we talked about earlier is burnout actually more prevalent or people just being more willing to say they're burned out, but they were always there. And I think it's both. And part of the piece around the prevalence of burnout increasing has to do with the fact that we are inundated with more information than we've ever been in the history of our species. Human beings have never been privy to the volume of information that we have at our fingertips. And not only does that affect us in the workplace because now you can be always on, you're always on the receiving end of information from multiple channels, email, instant message, whatever work tools you work with. You're also experiencing in your life outside of work. So yes, social media, but also just access to the internet and being aware of more problems than you've ever been able to be aware of in your life, and people feeling this sense of cognitive load, carrying all this concern around things that are thousands, hundreds of miles away, things outside of their community that they don't have control over. And
Yeah.
so people carry that with them, and it's very easy to understand why folks feel overwhelmed. I feel overwhelmed because there's so much that's demanding our attention, so much that feels so important, and so much of that is out of our control. And when
Mm.
people, especially, there is this kind of interesting intersection between people who are more likely to become burned out and people who become especially overwhelmed by all this information. That conscientiousness again, if you're a person that really cares a lot and wants to kind of influence what's in your life, what you read about, what you care about, you're going to carry more of a burden because you're going to feel more of this sense of responsibility. It's not only having the information, it's feeling like you need to do something about all of this information. And so, yeah, you take that happening in your life outside of work, you're mentally depleted, you're coming into a workplace that's, again, feeding you a lot of information that's moving fast. There's that cognitive exhaustion that we talk.
Yeah. Okay, that's I think that's really important for people to know and to understand because I do think that I hear this. It's one of the most prevalent things I hear from people is really, what is social media doing to me, and what is the external world doing to me? That's one of the things I want to really focus on is like what is not, now we've identified it, right? We're talking about it. We might identify that there's a problem. What does getting care look like? Like in a clinical setting,
Mhm.
obviously we encourage employees to get care wherever, whether it's through, we tell people use your EAP wherever you
Mhm.
are. We've got EAPs all around the world.
Great.
If you don't go through your EAP, go talk to your primary care doctor. Just, we want people to seek help. But when we think about mental health support. So you're in the US, you call Lyra, what does that process look like for somebody? What's treatment look like?
Yeah. Well, I would say the first thing I want to reassure people is you don't have to know exactly what you're dealing with
Mhm.
to go seek support. If you're even questioning whether or not you're dealing with a clinical condition, that's enough. That's
Yeah.
enough. The process of reaching out for support is really about you can either call or go to Lyra's website and simply give some information about what you're experiencing. I don't know what's going on with me clinically, but I know I'm feeling more exhausted. I'm feeling more frequently irritable. I'm feeling overwhelmed. Giving that information in a very simple format, either on the phone or through our website, will allow us to match you with providers who are trained in being able to evaluate and treat people with symptoms like yours. And so you don't have to know who's the right therapist, what's the right care. Maybe it's coaching. Maybe I don't need a therapist. Maybe I need a coach. That can all be figured out with the support of Lyra. We can help figure that out for you. And then once you actually start with, let's say, a therapist, but even a coach, their main focus in that first session is getting to know you, understanding what's most important to you. Is it to feel better, to show up better at work? What's getting in the way of that? And then using that information to tailor a treatment plan to you. And usually, what treatment looks like is having a clear goal that we're working toward that we can measure. So, when people say, "Oh, I want to feel better," the therapist in me loves that. I'm like, okay, you want to feel better. What would it look like if you were better? We were on the outside looking in. What would you be doing more of? What would you be doing less of? How would you show up in the world in a way that looks different? And then that gives us some concrete things to work toward. And the
Yep.
treatment's going to focus on how do we change your thinking that might be getting in the way of being in a better mood? How do we change your behavior, your ways of coping with the situation? And a lot of times it includes asking for help from other people in your life. That could be at work, it could be out of work. And then the last thing is changing how you deal with your emotions. So when these feelings of overwhelm come up, what are you doing to give yourself grace versus self-criticize? What are you doing to take a break versus push through? All of those things are going to be kind of entry points for intervening. And together they kind of combine to come up with a plan that ensures your thinking, how you cope with your emotions, and how you act in the world are getting you closer to those goals of feeling better and resembling someone who's doing all the things that someone who feels like you want to feel would be doing.
Yeah, that's interesting. When someone's dealing with burnout, is there and there's a question in our Q&A that can burnout be minimized with diet and exercise? But that leads me to, like, are there things you can do adjacent to therapy and to, clinical help that can help support your treatment of burnout?
Yeah, so it really requires a kind of multifaceted approach. So, to the diet exercise piece, I would say that's part of what any therapist or coach would work with you on is first auditing the basics. And you can do this for yourself without going to a therapist. How are you doing in the key elements of self-care? Are you getting the 7 to 8 hours of sleep a night with a regular bedtime routine? Are you eating nutritiously at regular intervals versus not, plowing through your lunch break? Are you socially connected? Do you feel like uh, you're spending time that's quality time with the folks you care most about in your life? And also, are you doing things that bring you a sense of joy or meaning outside of work? Do you have hobbies or interests that you're engaging with just for the joy of doing them? If you're not, and then in physical activity, are you active in some way that's getting your body moving and meeting your body's needs for some kind of physical activity? If things are not feeling right in any of those five realms, that's a good starting point. And
Okay.
then what a therapist or coach would do is build on those basics and really focus more on what are the things that are showing up at work or how you're dealing with work because of what's happening outside that can be improved. But you're right. Like first we need those foundational things.
Yeah. And I think that's an important note to make because um, I do think it's easy to minimize caring for yourself, in the midst of maybe everything, or it feels self-indulgent, right? I'm gonna
Yeah.
like all these other things need my attention right now. The world is on fire, I'm worried about getting 8 hours of sleep, but that 8 hours of sleep is really, really important to getting better. So that's why I really wanted to highlight that particular question. But so we have a lot of questions in the Q&A that are about how do you really navigate this at work. And I think one of the things is like how do I talk to my manager. And I do think there is an individual, there are a couple things. One thing I do want people on the call to understand is that it's great if you can talk to your manager. I was able to. I was really lucky. It was great. You don't have to. If you are not comfortable, you can talk to HR, and you absolutely should. Like, HR
Mhm.
is there for a reason. If you are not comfortable, they can help you navigate that. And that is their job. So I want to put that out there. But I do think that there were two questions. One is, well, first, if I feel burned out, should I talk to my friends and family first before I talk to work? And then, like, if I do talk to my manager, like, how do I even broach the subject? How do I bring this up? Do you have any guidance for maybe how to approach this that in the right mannerism?
Yeah, yeah, I love that question. First of all, you should talk to your manager if you're feeling burned out. It's in both of your best interests. I think one of the hardest things about being a people leader, which I am in my role at Lyra, is feeling like someone has been struggling and you didn't realize it. And by the time you do realize it, it's already gotten to such a significant point that uh, their their distress is at a high level and their performance is suffering. And in those situations, it just becomes harder because you're needing to bring them back from the brink in a way that's a lot more urgent and severe. And what I would always appreciate as a manager is knowing as early as possible that someone is
Hmm.
struggling. So I would say that. And to frame it in ways that make clear what is within your realm of responsibility and what are you seeking help on. So the way I coach people around this is to tee up the problem and describe it in really objective terms. Like, hey, I've noticed, I maybe I have a lot of stress in my life outside of work, and then I bring that into work, and what happens is I notice because of maybe my workload or the particular nature of my work or the pace of the work, I often feel overwhelmed, and that leads me to feel like I can't keep up. And then that leads me to overworking. And I'm starting to feel like I'm unable to keep up with that pace. And now I'm falling behind, and that's hurting the business and it's hurting the team. And so, from my perspective, I'm, wanting to seek out some support or I'm looking for better ways to cope. But on the work side, I want to talk through how I can get clearer priorities about what I need to focus on versus what can wait. Or I want to understand how I can think about trade-offs. If I can't do this project in full, can I do a piece of it? Can I stretch the timeline? Can I get some more resourcing? So just some effort to show your manager, hey, I've thought about this problem from every angle. This is the piece I'm going to own. This is the piece I need us to own together, figuring out how to make the work feel feasible and sustainable so that I can deliver on the goals you have for us, but I'm also doing it in a way that uh, doesn't risk me, needing to feel like I have to check out of work. So making it a collaborative thing. And I think the last thing I would say is your manager might not have the answer immediately. And so, really, your job in bringing it to your manager isn't for them to immediately have a fix, it's for them to make a commitment to figuring it out together. So, what the ideal outcome of that first conversation is them saying, "Hey, I'm glad you brought this to me. We're going to figure this out. And here's maybe some initial things that we can try, but let's keep talking about it over time and checking in on what can work, what's feasible, and making sure that we are chipping away at this problem over time." Because the research tells us if you have a manager who's committed to helping you fix this problem, you don't necessarily need them to fix it right away to feel more hope and feel some relief.
Yeah, that's interesting because I know I came into this talking about it as the employee, but I'm a people leader too, and
Hmm.
I really like the point that that you're saying that, I'm certain people on my team have come to me and and I have had moments where I'm thinking I know I should know the answer to this, but like I'm human and I don't,
Yeah.
and we have to work through it together. So I think that what people can get out of this discussion today is that I'm sure that many of you are people leaders, and to kind of keep that in mind from both sides of it. There are also we offer through It's Okay and through Lyra, we have sessions for managers. If you are a people leader, we're talking about burnout today, but you want to learn more about how you can support the people that maybe are under your care. We have lots of resources for that because it's not always an easy line to walk. You are supporting the business, but you are also supporting your people. So I that brings up a really great point. There was a question in the Q&A about that I found I kind of left it because I went through this too, and somebody said, if you go to a doctor and you speak to them, they might prescribe antidepressants, but those don't necessarily make you feel any better, which I will say in my own journey, I started with my primary care doctor and that happened, and I did not like
Mm.
that. And I did go to a cognitive behavioral therapist then through Lyra, and we didn't even get into meds. But it said, with EAP, you get a therapist, but then there is homework with journals and other activities, which are helpful, but also add more to your plate. So I'm going to ask you about that, but I'm going to also say to the person who put this question out there, I get it. I understand. I had the same reaction, and I came to find this goes back to that, like taking care of yourself. It's not self-indulgent to put that homework as a priority in your life to get better. And I found it once I gave over to this and I actually started to do some of it's uncomfortable. Like some of the things my therapist asked me to do, I was like, I don't want to do this. But when I did it, I felt so much better. So I want to say that. But like from your perspective, since you are at Lyra, can you talk a little bit about those tools and why they're so important?
Absolutely. And um, a side note that is related, but it's a little tangential. I also saw something in the chat or Q&A around um, is care via the EAP confidential? Yes. So everything that we're talking about in terms of getting therapy or coaching is always confidential. We never share that you in particular are getting care from Lyra. So that's first and foremost.
Yes.
Um, and you're right. A it often surprises people who maybe have never been in therapy before, or at least haven't been in therapy in a very long time, to know that therapy is actually very active. It's goal oriented, it's behavioral. Your therapist is going to ask you to take some skills that they're teaching you in therapy and go apply them in your life outside of therapy. And sometimes that'll look like uh, kind of recording what's happening in your day-to-day life and how you're coping with it and making some changes in how you typically respond. Sometimes it's about journaling. There's work. But the thing I would emphasize is that's what leads to recovery. The work outside of therapy is where the real change happens. And so I acknowledge like that can feel like a lot when you're already tired and you're overwhelmed. So what you and your therapist should work on is maybe your first kind of your first goal in the initial stages of treatment is doing some things that's going to give you a sense of recovery. So, how can you engage in some routines that bring about relaxation or rest? How can we intervene on some of the things that are getting in the way of you feeling like you can take care of yourself and recover? because first we need to build your capacity to be able to do some work. And then we're going to kind of ramp up the homework. And that means, yeah, practicing some skills, documenting some of what's happening. And I would just say, if you're feeling skeptical, if you're feeling overwhelmed, or you think about therapy as this thing where you're kind of coming and talking and venting for an hour and leaving it all behind, trust the process and really actively engage, because what you do outside of the therapy space is what's going to make those skills stick and ultimately lead you to not need therapy forever. You're going to be able to graduate from therapy because you really internalize the skills that therapy taught you, and you'll be able to practice them well beyond after you met with your therapist.
Yeah, I do think that's a lived experience for me. And I think that, and I will tell people all the time that, therapy can be something that's almost like mental yoga. Like I love yoga. I don't go all the time, but then suddenly I'm like, yeah, I'm really feeling it. So I think I'm going to go. And then I am reminded of those skills that I learned, and which is why I try to encourage people, to forget the stigma and realize it can be, and in the U.S. with Lyra, we know that we have cognitive behavioral therapists, but there are also coaches as well, which is a really nice alternative if you've never really gotten into therapy or tried therapy. It's a great step up into that. A question that is common in the Q&A, and I think it's a difficult one, is, we're at work, a significant portion of our lives, and that time is consistently guided by performance. What are we performing to? And every year we have a work plan, and you perform to those goals. How does somebody think about taking care of themselves and and still, and I think we've talked about it a little bit here, but still meet those goals? One of the things I would say is, it's okay if someone on my team came to me and said, I need to revise these. This is what I said I was going to do, but I have these factors in my life that are making this very difficult. What can we do? What can we do uh, to adjust these so that it's a win-win for everyone? But there are always going to be situations, and I wish that I could sit down with every manager in the company and say, here's how to handle these situations, but I can't. There's always going to be somebody out there maybe who doesn't understand. What does somebody do? There was another question where somebody said, like, if I feel like I'm suffering burnout and a lot of it is job related, should I change jobs?
Yeah.
Yeah, like, so what are some of the guidance that you would give to that situation?
Yeah. I would say don't change jobs yet until you talk to your manager. And what can often happen is in having a conversation about burnout, if you frame the problem right, it's good to do some pre-work before you talk to your manager to try and pinpoint what exactly is making this hard, and kind of force yourself to try and think a little deeper about it. So a lot of times people will stop at there's too much work. And sometimes that's just the reality of it. It can feel like there's too much work, but what else? Are there things that you might need to be able to keep up with the work? Is it that there's too much work, but you feel like maybe not all of it is important, and so you need clarity about what to focus on? Is it about feeling like there's a lot of work, but you don't have the autonomy to figure out the best way to get the work done? You feel like you're being forced into a process that's not efficient or doesn't work. Is it that there's a lot of work, but there's no one you feel like you can ask for help from? So try to get a little more curious with yourself about what are the different factors at work that might be making this challenging. And then you're talking with your manager not just about there's too much work, which makes it harder to diagnose what to do about it. You're starting to offer up some hypotheses like there's a lot of work, and I feel like when I try to delegate, I can't. Or I feel like when I try to get more support or resourcing, it's not available when it used to be before, and I'm trying to understand why. Or I feel like I have so many things to focus on, but I don't know what order I should prioritize. Can I get role like some clarity there? Or I feel like my role has shifted a lot over time, and now I'm looking up and realizing I don't recognize my role anymore. Can you
Yeah.
help me give some clarity to what's within my scope and what's out of my scope? Just be willing to try to get a little more detailed in what's driving the burnout and recruit your manager for help in getting some clarity or some extra resourcing or extra support in those more specific factors that are driving your burnout. That's what I would say is
Yeah.
kind of the first step before you go to any extremes of thinking about
Yeah.
walking away.
Yeah. Okay. I think that's really helpful. Another question that we had, and the question is written as, is grief relative to stress, burnout, or neither? And I guess what I interpret that as is certainly I think there is you can be grieving and experience depression, anxiety, burnout. But what about the other way around? Can burnout cause feelings of grief? And like how do you pull those apart?
Both, yeah, you're right. It works in both directions.
Yeah.
If you're experiencing grief outside of work, that is something that can deplete you and make it harder to show up at work with full capacity. And you have to acknowledge that and give yourself grace. Expecting yourself to show up at full capacity if you're dealing with grief and loss is not realistic, and it's going to hinder your ability to heal through that grief. So certainly in that direction, it's clear we need to allow for the human experience to happen around that grief. In the opposite, it can also be true. Sometimes people will experience a sense of grief, not maybe in the same flavor as, losing a loved one, but a sense of loss over maybe your identity. Like, oh, I used to be, we see this a lot with people who transition roles. Like, oh, I used to be a really great individual contributor. Like, I was a really strong individual performer. Now I'm a manager. And now I don't feel as capable anymore, or I don't feel as effective anymore, or I don't even feel like I understand what my role is. And that gives me a sense of grief. I'm grieving the loss of my old role. I'm grieving the loss of my sense of confidence or clarity about how effective I am. And now I'm in this new realm where I'm having to go through a lot of adjustment. So anytime that work is requiring you to go through a period of major adjustment, feelings of grief can follow.
Well, and and again, as we talk through all of this, and I know there are lots of questions in here, some of them we've touched on, and so I know we only have a few minutes left. A question that, and this comes up a lot when we talk about therapy and mental health, somebody is saying, I tried therapy and I didn't really love my therapist, so how do you assess how do you find the right therapist, and how do you know if you're on the right track with that therapist?
Yeah, it is true that the fit between you and the therapist is really important. It helps predict a good outcome. But what I would say is expect that the first maybe even two sessions are going to be you getting a lot of questions. The therapist needs to understand you, what you're dealing with, your goals, your background, in order to tailor treatment to you. So I would say usually the first or second session can be hard to get a good gauge of whether this is a fit or not because there's just going to be a lot of uh, interview that the therapist needs to get through. But something that might help is for you to talk with the therapist in that first session about what you feel you might need to feel like there's a fit. And sometimes that's helpful to reflect on before you start therapy. So for some people, it may be like, hey, I need you to be curious about different aspects of what kind of shaped me, my cultural background, my family background. Um, I want to know that I can connect with you on some of these important things. Or maybe it's about personality fit. Like, hey, I need my therapist to show up in a way that feels um, like they're going to hold me accountable. Like you're not just kind of validating me and making me feel like I'm supported. You're challenging me to actually change and show up differently. I need that push. So think about like if you had a good fit with a therapist, what would that look like? And make it explicit to your therapist up front so it gives them the opportunity to show up in the way that you want them to show up. And the last thing I would say is there's nothing wrong with changing your therapist. At Lyra, we will happily find you another provider or set of providers so you are always able to switch. But it may help to give the therapist some feedback before you make a switch. So,
Yeah.
because sometimes if you're struggling with something in terms of how that therapist is making you feel, that can actually be pointing you towards something that's going on outside of therapy. Like it may be that that therapist is reminding you of someone or something in your life, and working through that with the therapist can actually be therapeutic. So you might try giving some feedback and seeing where that leads to in terms of whether or not that issue between you and the therapist has some bigger significance or meaning.
Yeah, that's great advice. And I know, we've got a few minutes, and I want to end with this question. And I know there are lots of questions. We couldn't get to all of them. The session is recorded. I want to remind everybody if you do want to go back through it. Somebody made a really good point that is saying, there's all kinds of things to take care of ourselves, but they said that many of us are in a position to help the people around us either avoid burnout or deal with burnout. So do you have any, words of wisdom about, noticing it in other people or supporting the people around you who, one of the comments is like overwhelming people, right? Like, so I, as a leader, try to consider how much am I putting on people because everybody's got a breaking point and I don't want anyone to get to that breaking point. So I think there's a lesson in like, let's treat people the way you would want to be treated. But outside of that, just looking at the people around you, maybe it's a loved one, maybe it's a coworker. How can you help support somebody who may be experiencing burnout?
Yeah, I love that question. It comes with a lot of good intention, which is great. There are signs to notice that someone is burned out. When you notice that people are working beyond the hours that you expect them to work, if you notice that people are seeming checked out, especially if they used to be particularly engaged, if you're noticing that people are on edge and irritable in interactions with you, with colleagues, and that's unusual for them, or if you're noticing that people are starting to be like miss deadlines or deviate from their typical how they show up at work,
Yeah.
all signs to get curious. And the way to support is to simply say, hey, I noticed this thing. It seems unusual for you, or it made me curious to want to understand how things are going for you. And you're keeping it non-judgmental. You're saying, I just noticed this and I wanted to understand more. And you're inviting them to share as much or as little as they want. And if they do share that they're dealing with things that sound like burnout, they're feeling overwhelmed, checked out, ineffective at work, that's where you can get curious as the manager on things within the workplace that you can do. Help me understand what's making the work hard. Help me understand what it might have looked like at a time before when you felt more able to do the work. And working with them on the things that are within your span of control as a manager is going to be what gives them the most relief. And you can also refer them to Lyra if you feel like what they're sharing is also personal in nature and they could use some support with coping. Your job as manager is not to be therapist, not to fix it, but to point them to the resources that Cummins offers that can help them with their life outside of work.
Be curious and caring, I think, is a good way to sum it up. And
Sure.
so I know everyone's got to go. I know we're at the hour. On the It's Okay website, we have links to all of our EAPs around the world, plus a plethora of information that you can access at any time or your families can access. And so, Dr. Joe, thank you so much for again supporting us during this session. And we hope that we have you back in the future. And for all of everyone who attended, thank you so much. And I'm sorry if we did not get to everybody's questions, but we will have the session posted for future viewing. So thank you.
Thanks so much.
Okay.
Take care,
All right.